Hello everyone, welcome back to my channel Microbiology Simplified. I am your guide and mentor Dr. Amit Kumar Singh, and in this video PYQ series I will be discussing about Shigella dysentery. This is an important topic and I have seen question asked in several examinations including NEET PG, FMGE and INI-CET from this topic. So let's start with the video. The MCQ is about a 5-year-old boy who complains of bloody diarrhea with abdominal cramps. Culture of stool sample showed growth of organism which is non-motile and is not able to ferment lactose or mannitol. So what is the most likely organism? So what is the information given in the question is it is a case of a childhood dysentery, okay? And the organism which was grown was non-motile and non-lactose fermenter and non-mannitol fermenter. Okay, so if you see among the options given, this option C and option B, these two are motile with few exceptions. Okay, but however these two species are definitely motile. Okay, and so the answer will be either A or will be either D. So the other information given in the question is that is not able to ferment lactose or mannitol. So if you know about Shigella, that Shigella, first thing that Shigella is differentiated or classified on the basis of mannitol fermentation. So Shigella has got 4 subgroups. So subgroup A, that is Shigella dysentery, does not ferment mannitol. However, the rest of the subgroups ferment mannitol. So the first thing is linked with Shigella dysentery, that is non-mannitol fermenter, and this non-lactose fermenter. However, Shigella does not ferment lactose, but Shigella sonii may show late lactose fermentation. Okay, so again this sonii can ferment lactose. So sonii can ferment lactose and can ferment mannitol too. So the answer to this question is Shigella dysentery, which cannot ferment lactose or mannitol and is also non-motile, and yes, obviously is a commonest cause of bloody diarrhea among children. Okay, so this is the answer to this question, but then you should know about every other detail about bloody diarrhea and also about Shigella which can be asked during examination. So I am discussing those important things which you should know about Shigella. Okay, so to start with the bloody diarrhea, if you see the etiology, it can be either bacterial or it can be parasitic. Among bacterial, if you see the list is, it includes Shigella species, so it includes all the 4 subgroups of Shigella. Okay, and then E. coli, among E. coli, the 2 diarrheogenic E. coli which can cause bloody diarrhea is EHEC and EIEC. The EIEC resembles Shigella, okay, or resemble the disease caused by Shigella, that is shigellosis. But there are certain differences which I have discussed in the diarrheogenic E. coli video. But just for a quick recap, that the disease is little milder here, and the dysentery or diarrhea is occasional. Okay, though it can cause dysentery, but then it is occasional. Normally it causes mild watery diarrhea. Okay, then Salmonella enteritidis, Vibrio parahemolyticus, Campylobacter jejuni and Clostridium difficile. So these are the 6 organisms or 6 species which can causes bacterial dysentery. Among these, first to this Shigella and this EIEC, not only this EHEC, Shigella and this EIEC, these two together are known to cause bacillary dysentery, or in a better way I can say that actually the Shigella dysentery is known as bacillary dysentery, and as I told you this EIEC resembles Shigellosis, so it is also a cause of bacillary dysentery. Among parasitic, if you see, the agents are Entamoeba histolytica, which causes amoebic dysentery, Balantidium coli, which causes ciliary dysentery, Schistosoma japonicum and Schistosoma mansoni. These two together are known to cause bilharzial dysentery, and then Trichuris trichura. So these are the parasitic agents which are known to cause bloody diarrhea or dysentery. However, there is no viral cause or no fungal cause of dysentery. Okay. So if you'll see the various bacterial agent causing dysentery, among them the non-motile is only Shigella. And there is an exception in Salmonella, that Salmonella gallinarum and Salmonella pullorum are non-motile. Okay. And non-lactose fermenter, so except E. coli, all are non-lactose fermenter including Shigella. And in Shigella species, as I told you, Shigella sonii is a late lactose fermenter. And among Shigella, if you see, Shigella dysentery is non-mannitol fermenter, whereas the rest of Shigella species are mannitol fermenter. And the agent which is non-mannitol fermenter among the list of the bacterial agent causing dysentery, then Campylobacter jejuni is also non-mannitol fermenter, whereas the rest of them are mannitol fermenter. Okay, so that's why the answer to this question is Shigella dysentery. Okay, now about Shigella. Shigella has got 4 subgroups, as I was telling you. Group A, which is Shigella dysentery, Group B, which is Shigella flexneri, Group C is Shigella bordei, and Group D is Shigella sonii. Okay, and as I told you that among them, this Group B, Group C and Group D, these are mannitol fermenter, whereas Shigella dysentery is non-mannitol fermenter. Okay, and the mode of transmission is commonly through direct fecal-oral via hand, that is the person is getting the infection via contaminated hand. Okay, and also through fomites, contaminated food and water, the infection can be transmitted. And the source of infection, if you see, are human, and mostly the cases and less often the carriers. Okay, mostly the cases and less often the carrier. If you remember, I told you in case of pneumonia or pneumococcus, the source of infection were more carrier and less cases. Here it is more cases and less carrier. Okay, so this is important to know, that carriers are less often source of infection. Pathogenesis, if you see, the infective dose is very low. The infective dose is as low as below 100. So even 100 or less than 100 viable cells may cause infection. And the reason behind this is because they can resist the gastric acidity. They can resist the gastric acidity. And initially there will be watery diarrhea, and later on this watery diarrhea will progress to develop dysentery, and this may take around 2 to 3 days. Okay, so initially there will be watery diarrhea, and this watery diarrhea is because of active secretions of fluid, which is, and then abnormal water resorption, and this active secretion is because of Shiga toxin SHET1, and this abnormal water resorption is because of mucosal inflammation. So these two are the reason for initial watery diarrhea. Later on the dysentery supersede, and this dysentery is because of invasion of mucosa. So invasion is the main pathogenesis behind the dysentery. However, the disease starts with watery diarrhea. Okay. So now let's see the pathogenesis of Shigella dysentery or shigellosis. So if you see, this Shigella is attached or is taken up by this M cells. These M cells or membranous cell or microfold cells, these are present in the lymphoid micro follicles in the colon. Okay, and then when it is taken up by them, they enter into the subepithelial space, and in the subepithelial space they are phagocytosed by the macrophages, and once they are phagocytosed, this phagosome ultimately degraded and releases the bacteria, and this bacteria induces the release of IL-1 by the macrophages, and this IL-1 evokes the influx of polymorphonuclear leukocyte, and eventually this macrophages undergoes apoptosis, okay, and releases the bacteria into the basolateral surface of the adjacent enterocyte, and this PMN which is released, it transmigrate through the epithelial cells, and this loosen the tight junction. So this is taken as an advantage by the bacteria, and it enter inside the enterocyte and through a endocytic vesicle, and eventually this vesicle is also lysed, or and it multiplies and ultimately attaches to the actin which is present in the enterocyte junction complex. This and then utilizes this host cell actin polymerization for contiguous spread of infection. The similar mechanism I told you can be seen in rickettsia and listeria. Okay, that the utilization of host cell actin polymerization for the spread of infection to the adjacent cell. So this is the pathogenesis of Shigella. One more very important thing to remember about the pathogenesis is that this Shigella usually involve the mucosa. So the infection is superficial. The invasion is superficial. It rarely goes beyond the mucosa. Okay, so remember, the infection or the lesion in case of Shigella is superficial, involves only mucosa. Okay, so this is the pathogenesis. So now coming to the Shiga toxin, which is produced by this Shigella. The Shiga toxin is produced by Shigella dysentery type 1 only. Okay, and this is an earliest example of exotoxin produced by gram-negative bacilli. So exotoxins are basically produced by gram-positive bacilli. Okay, and endotoxin are produced by gram-negative bacilli. But this is an example of exotoxin produced by gram-negative bacilli. So remember this. Exotoxin produced by gram-negative bacilli is Shiga toxin produced by Shigella dysentery type 1. Okay. And this Shiga toxin is composed of a single A subunit and 5 B subunit. Okay, and this B subunit binds to a receptor called as GB3 or globotriaosyl ceramide. Okay, and this A subunit is active subunit, and this active subunit is basically an enzyme RNA glycosidase. This RNA glycosidase actually leads to RNA glycosylation or depurination of 28S RNA. Depurination of 28S RNA at a single site, that is at adenine base. Okay, and because of this, it will prevent the EF1 mediated binding of amino acyl tRNA to the ribosome, and thus it will inhibit the protein synthesis. So this is the mechanism of Shiga toxin. Okay, clinical feature, if you see, it has got 4 phases. The first phase is the incubation period, which is of 1 to 4 days, And the second phase is, as I told you initially itself, is watery diarrhea. And in watery diarrhea, if you see, it is associated with fever, limited watery diarrhea, malaise and anorexia. Apart from that, we can also see tenesmus and abdominal cramps. Okay, and the third phase is dysentery, which is characterized by fractional stool. Fractional stool means uninterrupted mucopurulent scanty blood containing stool. Okay, so this is characterized by fractional stools. So this is the characteristic of dysentery seen in Shigella. Small amount of stool containing mucus and blood. Apart from that, we can also see tenesmus, increasing tenesmus and increasing abdominal cramps. And it is usually seen, the lesion is usually seen in distal colon. And one more thing, dehydration is rare in case of dysentery caused by Shigella. Okay, remember this, dehydration is rare. So if in question if they mention dehydration, then the chances of Shigella being the causative agent is rare. And the fourth phase is post-infectious phase. This post-infectious phase is more life-threatening, especially in children below 5 years of age and among elderlies. And the complications which we can see are toxic megacolon, intestinal perforation, rectal prolapse, hypoglycemia, hyponatremia, and sometimes dehydration may be seen. Okay, so the important one are toxic megacolons, intestinal perforation, and rectal prolapse. Okay, so these three are very important. Apart from these complications, we may also see reactive arthritis, which is basically an immunologic complication, and it develops around few weeks, like 3 to 6 weeks, or maybe after 1 or 2 months. Okay, and it is especially seen among the patients with HLA-B27. Okay, and the species which is commonly associated with reactive arthritis among Shigella is Shigella flexneri. So there is a separate topic, and this is a separate video on reactive arthritis will be posted very soon. So go through that video and you will come to know about reactive arthritis everything. Okay, so there was a question in the examination, that's why I'm saying it to you. So if in examination, if you see a Shigella, 2 or 3 species of Shigella mentioned as a causative agent for reactive arthritis, so the correct option will be Shigella flexneri. Okay. Now coming to the Shiga toxin induced complication. So Shiga toxin induces complication known as hemolytic uremic syndrome, and it develops after several days of diarrhea. And this similar complication is seen because of a Shiga-like toxin produced by EHEC, and the strain or the serotype which is commonly involved is O157H7. Okay, and what is this hemolytic uremic syndrome? This hemolytic uremic syndrome is basically non-immune hemolytic anemia, and it is characterized by a triad. And what is the triad? First is microangiopathic hemolytic anemia, in which hemoglobin is below 8 gram per deciliter, and thrombocytopenia, in which platelet count is below 60,000, and then acute renal failure, and this acute renal failure is because of thrombosis of glomerular capillaries. So this is the triad for hemolytic uremic syndrome. Okay, and then the lab diagnosis. So for lab diagnosis, there is nothing much. We need to culture the stool specimen in certain selective medium and low selective medium. Enrichment broth can be used, and the enrichment broth which can be used are selenite F broth and gram negative broth, but these broths are primarily used for salmonella, and their role in Shigella is very limited. So it is always better to do direct culture of the specimen rather than using this enrichment broth. Okay, so remember this, direct culture of a specimen is better than using enrichment broth. And as I told you, the selective medium, we need to use 2 types of selective medium. One is of low selectivity and one is of high selectivity. Low selective medium which we can use McConkey agar, and high selective medium we can use XLD agar. XLD agar is xylose lysine deoxycholate agar. Okay, and apart from that, we can also use alternatively DCA agar and hectoine enteric agar. Okay, and what will be the characteristic of the growth obtained? So these are the 4 characteristics of the growth obtained. It should be there to confirm it as or to identify it as Shigella. Is first is glucose positivity, that it should ferment glucose but without gas usually. It should be non-lactose fermenter. it should not produce H2S, and it should be non-motile. So these four characteristics should be present on the colony obtained in the selective medium. Okay. And what should be the treatment? Treatment, there are first line drug and second line drug. The first line drug which is commonly used nowadays is ciprofloxacin, and the second line drug which is commonly used is cephalosporin and beta-lactams. Okay. And the duration of the treatment depends upon the immunity of the patient. If the patient is immunocompetent and if the infection is by Shigella dysentery, then the duration of treatment is around 5 days. If the patient is immunocompetent but the causative agent is non-Shigella dysentery, then the duration of treatment is only 3 days. However, in case of immunocompromised patient, irrespective of the causative agent, the duration of treatment is 7 to 10 days. So this is the brief about, I can say, about Shigella dysentery, but definitely I must say this pathogenesis is in detail, and about the toxin and the complication is in detail, and you will never miss any question from this topic if you go through this video completely. So don't think that it is going to waste your time. At the end you will get the benefit from the videos. Okay, so go through all the videos. Don't think that okay, it is too much and why to waste that much time only for microbiology. It is not only microbiology. I am not only including the content of textbook of microbiology, but also textbook of medicine like Harrison and Mandel. So just go through this video, and all the best for your examination. Take care.